Hi, good afternoon, and thank you for joining LA Care Health Plan and the Los Angeles County Department of Health Services for today's Facebook Live. I'm Brighton Kimbell, and today I will be interviewing Dr. Raymond Perry about staying safe this flu season, especially during the COVID-19 pandemic. We are so very fortunate to have Dr. Perry with us today. He is a man of many hats. Dr. Perry is a pediatrician and the director of the Hubert H. Humphrey Comprehensive Health Center, an outpatient health center in Los Angeles, serving patients of all ages on behalf of the Los Angeles County DHS. As director, he serves as the chief executive and chief medical officer for the center. He also holds an academic appointment as a clinical professor of pediatrics at the Charles Drew University of College of Medicine and Science, which I have to give a shout out to my personal hero, Dr. Prothos Stipp. If you can't tell, we are in great company today. So please join me in welcoming Dr. Perry to this live.
Well, hi, Brighton. Thanks for having me here today. Really excited to be here with you. And I'm excited to answer some of the most frequently asked questions that we've been getting this year about protecting our health during the flu season and during the COVID-19 pandemic.
Thank you so much. I'm sure everyone appreciates you being here. I know I personally do. It's been a tough year. 2020 has not been easy. It's been a year of a lot of worry. And while the flu season may come around often, it's even more, it's more scary. There's a lot more fear around it because it's compounded with the pandemic. So I know that LA Care and LA County have been working very hard to avoid what health experts have been referring to as a potential twindemic of the flu and the COVID-19 cases being compounded on one another. So I'm glad you're here with us today to share this important information and help us through some of our own worries. While we have gathered some common questions, I do want everyone to know who is looking at this live right now that you are welcome to actually type your questions into the chat. There are doctors, LA Care and LA County members will be actually replying directly to your questions. We won't be able to see them, but they will be there. So go ahead and use the comment section below. All right, Dr. Perry, let's get started. Who should get the flu shot and why?
Well, the CDC recommends that anyone who's 6 months of age and older should get vaccinated against the flu every year. So kids under 5, older adults, pregnant women, and people with chronic health conditions like diabetes and asthma are at high risk of flu-related complications. And many of these same people are also at risk of COVID-19 complications. And this is why it's especially important that they get the flu shot. But really, we should all get the flu shot because even if we don't fall into one of these high-risk categories, we probably have someone in our lives who does. And by protecting ourselves from getting the flu, we're also protecting them.
Right. I know that a lot of the high-risk populations that you just mentioned, I definitely have in my own family. And for many of us, flu season comes around once a year, like the leaves on the trees turning orange, right? It just comes every year. We know it's coming, but this is not the average flu season, is it, Dr. Perry? Public experts are actually saying that it's more important than ever for people to get their flu shot this season because of COVID-19. Can you explain to us why it's even more important this year?
As I mentioned, many people who are at risk of flu complications are the same people who are at risk of complications from COVID. And for these people, getting the flu might mean that they have to go to the hospital. And right now, resources are stretched really thin due to COVID-19. So now more than ever, we really want to do whatever we can to keep people from having to be in the hospital. And for those people who've already had COVID-19, the flu may also be really bad. Both the flu and COVID-19 are respiratory illnesses. And that means they infect your lungs and they can cause problems with breathing. So if you've had COVID-19 and if you've recovered, you have more of a reason to get the flu shot because your lungs may have already taken a hit from COVID-19 and they may still be building back their strength. You definitely don't want to have to fight the flu virus too. And we know that COVID-19 is out there and we know that we don't yet have a COVID-19 vaccine, although hopefully we're getting very close. You don't want to risk contracting both COVID-19 and the flu, and definitely not at the same time. So we have a way you can protect yourself from getting the flu. That's by getting the flu shot. And then lastly, in addition to getting the flu shot, we've heard this over and over for the last several months, but it's more important than ever that we all wash our hands, that you wear a mask, Stay home whenever you can. And if you do need to be around other people, practice physical distancing so that you can avoid getting sick and you can hopefully help to keep our hospitals from getting overcrowded.
Thank you. And earlier we were talking about all the vulnerable populations that many of us, such as myself, have in our own families: kids under 5, older adults, pregnant women, people with chronic conditions such as diabetes. So all those people you've just described, my brother, my grandfather, my best friend who's pregnant. So is it safe for everyone to go ahead and get the flu shot? Are there any adverse reactions that people should be worried about? And what if someone also has already had COVID-19? Is it safe for them to get the flu shot?
Great questions. So adverse reactions from the flu shot or bad side effects are actually really rare. The most common reaction that we see is just some soreness at the injection site, and most people will get the injection in their upper arm. To your second question about people who've had COVID-19, they don't have any more risk of having a bad reaction from the flu shot than anyone else. So it's safe. And as I said earlier, if you've had COVID-19, there's even more of a reason for you to get the flu shot because you want to make sure that you can protect your lungs.
Okay, so thank you for that. And don't laugh at my next question. This is a real question that people have and that I've heard myself. I'm not going to name any family or friends, but there's a longstanding urban tale out there that the flu shot gives you the flu. Is that true? Does the flu shot give you the flu?
Right, and that's a very common myth about the flu shot, and I hear it from a lot of people every year. In reality, getting the flu shot is not going to give you the flu and make you sick. People who do get the flu after getting a flu shot most likely became infected with the flu right before they got vaccinated, or maybe they got the flu before the flu shot had a chance to take its full effect.
And how long does it take to take its full effect? How long does the flu shot take?
Well, it can take up to 2 weeks for it to take full effect. And this is why we say people should get the flu shot as soon as they can, either before or at the start of every flu season. The exact timing and the length of the flu season, it can vary from year to year, but usually it starts in October. It can peak around December to February, so really right now, and it can last as late as May. But it's never too late to get the flu shot. If you haven't gotten the shot already, now is the perfect time to go and get it.
Great. I'm definitely going to pass this information along to my friends and family. It does not give you the flu. I'm also thinking about I've been thinking about my grandpa a lot actually this year. He's 92, which is awesome, but also makes him very vulnerable. And he is so good about staying at home and making sure that, we didn't even see him for Thanksgiving. We didn't see him on his birthday. But he is he's a bit reticent about going out to the doctor's office, to do certain appointments, such as getting the flu shot. What do you have to say to folks like that? What can I say to my grandfather and other people who feel like they just want to stay at home? Is it safe for them to go to the doctor's office?
Well, it's a great question, Brighton, and a really good concern, especially in Los Angeles County right now, because we know that there are stricter stay-at-home orders that went into place this week because of the recent rise in COVID infections. Mm-hmm. But yes, it is safe to go and get your flu shot. I understand that people might be hesitant to go anywhere in person. And also, people have gotten used to getting a lot of their medical care virtually over the last several months. A lot of people now have their clinic visits over the phone or by video. But you do have to go in person to get the flu shot. And our providers are doing a lot to maintain patient safety and fight the spread of COVID-19. So again, I would say it is safe to go to a clinic to get the flu shot.
Great. So it is safe to go out to the clinic and get your flu shot. What kind of safety measures can we expect when going to our doctor's office for the flu shot?
Good. There's lots of safety measures that are being taken at doctors' offices throughout LA and around the country. You're not going to have to wait in a crowded waiting room to get your flu shot because all of our providers are starting to space out the timing of the appointments so not as many people are in the office at the same time. The offices are also enforcing physical distancing in waiting rooms by spacing out where the seats are. They're taking patient temperatures before people even come into the clinic, and they're requiring everyone to wear masks, staff and patients. We're also sanitizing all of our waiting rooms and our patient exam rooms even more often. So all of these things together that we're doing will really help to prevent the spread of COVID-19, and they're making doctors' offices safe places to go and get the flu shot right now.
Great, thank you. And I also know that in order to make the flu shot even more accessible to folks, LA Care and also some other organizations have been hosting flu shot clinics for the community at large. What can people expect when getting their flu shot at these types of events?
Well, Brighton, the main thing to know is that it's really safe and really easy to get your flu shot at these events. You can drive up to them, and you usually don't even have to get out of your car. Some clinics do offer a walk-up option for people that prefer that or for people who don't have a car. And combined, LA Care and LA County have already given out thousands of flu shots. And we've gotten a lot of great feedback from the community members too about how easy it's been. So you should first reach out to your primary care doctor to go and get the flu shot there. But if that's not an option, you can go to www.preventflula.com, or you can call 211 to find free or low-cost flu clinics near you. And you can also find information about LA Care's flu shot clinics by clicking on the link in the About section of the LA Care's Facebook page.
Awesome. So just one more time, and call 211 or also preventflula.com. And also, of course, LA Care's bio. You can actually, on Instagram, it's super easy. You go to the bio and then there's a list of things that come up and you can specifically look for flu shot clinics. Now, I don't want to go too deep into this next question, Dr. Perry, because it could be a whole nother Facebook Live interview topic. But I've heard rumors on social media that a COVID-19 vaccine is being added to the flu vaccine so that it's being tested on people. Is this true that this is happening?
Well, Brighton, I've actually heard these rumors and gotten questions from my own patients about this, and it's simply not true. When you go and get the flu shot, you're only getting the flu shot. No other vaccine is added or being tested. There's no testing being done with the flu vaccine because we already know that it's safe and effective. Doctors and other frontline workers in LA County have been getting the flu shot this year and every year. I myself have already gotten the flu shot, so has all of my clinic team and my family members too. For my clinic team, we've all gotten the flu shot because we know how important it is that our frontline staff have protection this year, because there's a possibility of double exposure to COVID-19 and the flu, like we talked about at the beginning. So the single most important thing we can do to protect ourselves is to get the flu shot, and that's true for everybody.
Thank you so much, Dr. Perry. Those are all the questions I actually have today. We flew through all these questions. I mean, I'm sure there's so many more that, please, people, put them in the chat. There are doctors there who are directly going to be answering your questions. But those are all the questions we have at the moment. Thank you to all of our viewers. Thank you for your efforts to keep yourself, your family, your friends safe, keep the greater Los Angeles County safe from the flu and the COVID-19 viruses. And just a reminder, as Dr. Perry spoke about earlier, just follow the 3 W's. Wear a mask, wash your hands, and also watch your distance by avoiding close contact settings.
That's right, Brighton. We know that everyone's been affected by the coronavirus outbreak, and there's a lot of fatigue in the community in relation to following these social distancing guidelines and other COVID-19 safety guidelines. But this year, more than ever, it's more important that we continue to follow these guidelines and that we get the flu shot so that we can continue to keep our loved ones safe, our neighbors safe, and of course ourselves as well. LA Care and LA County are here to support you and everybody, not only with getting the flu shot, but also with other community resources like access to food, rent support, and mental health services. If you want more information on these resources, you can visit communitylink.lacare.org. And our staff will share this link for these resources in the comments section on Facebook. And you can also access the link through the About section on LA Care's Facebook page. So be sure to follow Los Angeles County and LA Care on Facebook and on Instagram so that you can get important updates on flu and COVID-19 safety. If you want more details on how to fight the flu, you can check out the flu vaccine information tab, which is on the link in LA Care's Facebook page. So we will get through this together, but please stay safe, wash your hands, wear your mask, and of course, get your flu shot. Thank you very much.